Hello, everybody. I'm Keith Deserick with The Cure Starts Now, and I wanted to take an opportunity to talk to you a little bit about a tool that you may not be aware of. It's a tool that we designed here at The Cure Starts Now for patients and parents that are fighting DIPG, DMG, and it's really designed to make your life easier. If you're like us, and we were parents as well, my wife and I, Brooke, were fighting alongside of our daughter, Elena, back about 13 years ago. Now, obviously, times have changed a little bit, but back then, we were walking around with a binder. Binder looked much like this. It was a 3-inch binder, and in it, it held all of the trials that we were printing up each night. And we kept an eye on it because as she would go through progression, as we would go ahead and look at different hospitals, or frankly, just some of the technology or things would change, we wanted to have top of mind awareness of whatever trial was coming down the path so we could give our child the very best chance at being able to beat DIPG and DMG. At that time, we would go ahead and print this up. We would call on the phones. We would speak to many different hospitals. And we just found that it was very involved. It was almost like a full-time job all by itself. So when we went ahead and created Dipg.org, and you may be familiar with the website, and I'm going to show it to you as well, just so you get a little bit of an idea of it. But when we went ahead and created Dipg.org, our entire purpose of doing so was to put the power of information in the hands of you, the parents, or you as the patient, so that you knew factual information about DIPG, but you also were able to get rid of the binder. And so what we went ahead and put here is a clinical trial finder. And you can simply go right to the website, and I'm showing it to you right on the screen here. And you can click View the Trials. And what this does is this actually goes out and queries all the trials in the US, in Canada, in Europe, and Australia, and New Zealand. So it's a pretty good cross section. You'll even find some of them will cover China, some of them will cover Russia, and so forth, so on. But those are the main countries. And if you look at this, we have trials, and it shows you right here, 70 clinical trials that we have all across the entire world. And this is listed not necessarily in any order other than what was the last update, because we know that you as parents are going to want to come in here almost on a daily basis and to try to check and see if there's a new trial that opens. Because keep in mind, trials open and then they close. And so you're really concerned about those trials that are open that you can enroll your child in. It even shows you the country. It even shows you the sponsor or the organization or the consortium that goes ahead and offers that. You can scroll down on this and you can see trials and you can see the dates that it updated, which means something changed. And that's what we reference there so that you know possibly whether it's open, possibly whether it moved to another phase, but you can see the dates of those change. Now, what that means, that's different by each of the trials. So you actually have to click in on each one of these trials to figure out what has actually changed sometimes. So if we click on these trials, here it will actually take you back to the native site or the site that we felt gave you really the most information possible on those specific trials and the one that updated most currently. And so you can actually look at this, in this case, clinicaltrials.gov for this one, and you can actually pull it up and learn more about the trial, find out what institution is carrying it, and really what are the elements for enrollment on this. The purpose of this is simple. We want to put the power of information in your hands. We want you to be able to evaluate what trials are there. And we also realize that, unfortunately, a lot of times when you're sitting there at the hospital and talking about your son or daughter's treatment, even the doctors may only know of 2 or 3 different trials. They certainly aren't aware of 70 different trials. And we sometimes also find that the doctors that are consulting with you are actually going on this website and pulling up the information here. So we'd much rather have you have the information as well, so that way you can make a good evaluation. We're not making any determinations. All these are just the trials that are open. And so it's important that as you go in, you speak with your doctor, you might even print up some of this, and you might go through each of these trials and say, well, what about this? What about this? So that way it can be a decision made between you and your doctor who knows about the care for your son or daughter best. There's also other ways that you can get up to speed on this type of information. If you go back and we look at some of this, you'll see that in the active clinical trials at the bottom, and also on the main page for Dipg.org, which I'll click back out here, you can actually sign up for updates. And so if you click that, it will take you actually to a sign up form. This is where you can type in your email address, your first name, last name, your zip code, And then you simply have to tell us whether you want to be updated on a daily basis or whether you want to be updated on a weekly basis. And that's designed not because of anything other than to just give you information. We try our very best to relay that as best as we possibly can. Obviously, it's a beta because some of these do change, and sometimes they change their systems, and we try to keep up with it. But it's a great way of really getting up to speed, not having to carry around a binder with you, and really being able to offer custom treatments and know what's going on in the world out there of DIPG. Please, obviously, stay tuned. We're going to give you many other updates, but more importantly, visit dipg.org. This is a site created by parents for parents. The information that we have on this, we're not looking to sign you up for giant mailing list or anything like that. We're just trying to keep you in the know, and it's something that we as parents want to try to make sure that is available to those parents that are in the fight right now. So thank you for tuning in, and we'll talk to you soon.